The following is a mandatory training produced by the Vermont Department of Health and the Vermont Department of Labor. Protecting the Safety and Health of Workers, Coronavirus Disease 2019. All employees, including those already working, except healthcare workers, first responders, and others already trained in infection control, personal protection, and universal precautions, must complete and employers must document this training on mandatory health and safety requirements, or another training program that meets or exceeds this VOSHA provided training by the time they start work. What is novel coronavirus? Coronaviruses are a family of viruses that can cause illness in people. Coronaviruses circulate among animals, including camels, cattle, and cats. SARS-CoV-2, the seventh known human coronavirus, and the virus that causes COVID-19, is thought to have jumped species from animals to begin infecting humans. What is coronavirus disease 2019, or COVID-19? COVID-19 is a respiratory disease spread from person to person. The virus that causes the coronavirus is the novel coronavirus that was first identified during an investigation in an outbreak in Wuhan, China. How is COVID-19 different from other known coronaviruses? Several coronaviruses cause common colds, but are not significant threats for most healthy people. Other coronaviruses have caused past outbreaks, including severe acute respiratory syndrome, SARS, and Middle East Respiratory Syndrome, MERS, each caused by a different coronavirus. SARS-CoV-2 is a distinct coronavirus. How does the coronavirus spread? The virus is thought to spread mainly from person to person. The virus spreads by droplets made when people with the coronavirus cough, sneeze, or talk. These droplets can land in the mouths or noses of people nearby or be inhaled into their lungs. People who are infected often, but not always, have symptoms of illness. People without symptoms are able to spread the virus. It may be possible that a person can get the coronavirus by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads. Not everyone infected with the COVID-19 virus has symptoms. Symptoms include mild to severe respiratory illness. The symptoms may start 2 to 14 days after exposure to the virus. Symptoms include fever, cough, shortness of breath, or difficulty breathing. Chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell are other symptoms. If you are having symptoms of COVID-19, call your medical provider. If you are having a medical emergency, call 911 or go to the hospital. The current pandemic. There are more than 2.7 million cases worldwide as of the production of this slideshow. Different parts of the U.S. are seeing different levels of COVID-19 activity. All 50 states have reported cases of COVID-19 to the CDC. U.S. COVID-19 cases include imported cases in travelers, cases among close contacts of a known case, community-acquired cases where the source of the infection is unknown, and most U.S. states are reporting community spread of COVID-19. If you have been exposed or infected, prior to seeking treatment, alert your healthcare provider or occupational health clinic if you think you have COVID-19. Tell your healthcare provider if you have been exposed to someone with the virus and have signs or symptoms of infection, as well as about any recent travel to areas where COVID-19 has spread, including other states. If you are having trouble breathing or have any other concerning symptoms, call 911 for immediate help. Diagnosis and treatment. Your healthcare provider can determine if you should be tested for COVID-19 based on any symptoms you might have and the severity of them. There is not currently a vaccine or specific treatment for COVID-19. Some patients, especially those who become very ill, may require supportive care in a hospital. Occupational exposure risks. OSHA is closely coordinating with CDC, including the National Institute of Occupational Health and Safety, and other agencies to monitor the ongoing pandemic. The risk of exposure in many workplaces likely reflects the risk to the general public in the community where the workplace is located. Risk can increase when workers have frequent close contact with the general public or other coworkers. Occupational exposure risks. Workers in some sectors may have increased risk of occupational exposure to COVID-19, including in healthcare and laboratories, emergency response, mortuary services and other death care, airline operations, border protection and passenger screening, critical retail operations including grocery stores and pharmacies. Existing OSHA standards protect workers from exposure. Follow existing OSHA standards to help protect workers from exposure and infection with COVID-19. Employers should also remember that OSHA can use the General Duty Clause, Section 5A(1) of the Occupational Safety and Health Act to ensure that workers are protected from recognized safety and health hazards that may cause serious harm. Relevant OSHA requirements are on the right side of this slide. Work sectors with a very high exposure risk include healthcare workers, including doctors, nurses, dentists, paramedics, and EMTs, performing or present for aerosol generating procedures on known or suspected COVID-19 patients. Healthcare or laboratory personnel collecting or handling specimens from known or suspected COVID-19 patients, and morgue workers performing autopsies on bodies of people who are known to have or suspected of having COVID-19 at the time of their death. Work sectors with exposure risk considered to be high include healthcare delivery and support staff, exposed to known or suspected COVID-19 patients, medical transport workers, moving known or suspected COVID-19 patients in enclosed vehicles, and mortuary workers involved in preparing the bodies of people who are known to have had or suspected of having COVID-19 at the time of their death. Work sectors with exposure risk considered to be in the medium category include jobs that require frequent and/or close contact with people who may be infected with SARS-CoV-2, but who are not known or suspected COVID-19 patients. Examples include critical retail workers, such as those in pharmacies and grocery stores, transit workers, such as bus drivers, subway operators, and taxi drivers, workers in other transportation operations, and anybody working in a park. Work sectors with low exposure risk include jobs that do not require contact with people known to be or suspected of being infected with SARS-CoV-2, nor frequent close contact within 6 feet of the general public. Workers in this category have minimal occupational contact with the public and other coworkers. Mandatory health and safety requirements for all business, nonprofit, and government operations. All businesses must follow Vermont Department of Health and CDC guidelines and VOSHA standards. Mandatory requirements. Employees shall not report to or be allowed to remain at work or a job site if sick or symptomatic. Symptoms include fever, cough, and/or shortness of breath. Non-symptomatic COVID-19 positive workers are not allowed on site, and any workers who have contact with a worker or other person who is diagnosed with COVID-19 are required to quarantine for 14 days. Signs must be posted at all entrances, clearly indicating that no one may enter if they have symptoms of respiratory illness. To the extent feasible, prior to the commencement of each work shift, pre-screening or survey shall be required to verify each employee has no symptoms of respiratory illness, including temperature checks. Temperature checks. A temperature of 100.4 degrees Fahrenheit or higher is considered a fever, as according to the CDC. At the present time, non-contact thermometers are in short supply. However, employers shall immediately order and use their best effort to obtain thermometers in order to conduct routine temperature checks. All employees must observe strict social distancing of 6 feet while on the job, unless noted, and should refrain from touching their faces. No congregation of employees is allowed. If possible, access to common areas, break rooms, or lunchrooms should be closed or controlled. If the nature of an employer's work or the work area does not allow employees to safely consume meals in the workspace, an employer may designate a common area or a room where meals may be safely consumed provided all conditions are met. At the entrances of the designated common area or room, the employer shall clearly post the policy limiting the occupancy of the space and the minimum social distancing, hand washing, hand sanitizing, and space cleaning requirements. The employer shall limit occupancy of designated common area or room so that occupants maintain strict social distancing of no less than 6 feet per individual. The employer shall enforce the occupancy limit. Employees shall be required to wipe down their area prior to leaving, or there shall be cleaning of the area at regular intervals throughout the day. Hand washing facilities and/or hand sanitizer shall be immediately available at entrances of designated common areas or rooms. When working inside, open doors and windows to promote airflow to the greatest extent possible and limit the number of people occupying a single indoor space. No more than 2 people shall occupy one vehicle when conducting work and shall wear face coverings when riding together. Employees must wear face coverings over their nose and mouth when in the presence of others. In the case of retail cashiers, a translucent shield or sneeze guard is acceptable in lieu of a mask. All common spaces and equipment, including bathrooms, frequently touched surfaces and doors, tools and equipment, and vehicles must be cleaned and disinfected at the beginning, middle, and end of each shift and, when possible, prior to transfer from one person to another. Employees must have easy and frequent access to soap and water or hand sanitizer during duration of work, and hand washing or hand sanitizing is required frequently, including before entering and leaving job sites. Businesses may ask customers to wear face coverings anytime they are on the premises and interacting with employees and other members of the public. You can find more information on new work-safe additions to the Stay Home, Stay Safe order on the ACCD website. Guidance for employers. Have a plan. Start with assessing the hazards in your workplace. Just as in all other hazards, the hierarchy of controls is an important concept. Elimination, substitution. Tasks should be evaluated for the possibility of working remotely. Meetings, conferences, and trainings should be done via the internet or virtually. Client-patient services should be done via the internet or virtually. Employee-to-employee contact should be eliminated by spreading out workstations. Employees should be encouraged to stay home if they feel ill in any way. This needs to be uniformly communicated. If feasible, temperature testing employees should be done. Engineering controls. Consider physical barriers to prevent spread, including workstation barriers and sneeze guards for cashiers. Isolation of tasks should be considered where possible. ventilation patterns and air change rates can assist in lessening contamination. Administrative and work practice controls. Work practice controls can be very effective in preventing the spread of COVID-19. Understand the basic principles of prevention. Social distancing. Social distancing is when people are able to maintain a minimum of 6 feet apart. Personal cleanliness. Hand washing facilities and hand sanitizing must be provided, readily available, and their use must be encouraged. Work surface cleanliness. Employers should implement protocols for regularly cleaning and disinfecting high-touch surfaces in the work environment. Wipe down surfaces such as door push bars, shopping carts, point-of-sale machines, chairs and waiting areas, and other areas that customers, visitors, or workers frequently touch. Employee training. Train all workers about their risk of occupational exposure to COVID-19, as well as on what to do if they have traveled to high-risk areas or been exposed to possible cases. For workers at high-risk exposure areas, including the healthcare sectors, discuss sources of exposure to the virus and hazards associated with that exposure, appropriate ways to prevent or reduce the likelihood of exposure, including use of engineered and administrative controls, safe work practices, and PPE. Some OSHA standards require worker training. Personal protective equipment, or PPE. Make sure there is good understanding of what is and what is not considered PPE. Things that are PPE. Gloves. Various gloves protect against varying hazards. Most commonly, medical grade gloves are used to protect against pathogenic hazards. Body protection. Most often, varying forms of protective suits are worn to protect from pathogenic hazards. In the case of facilities with direct contact of known or suspected COVID-19 infection subjects, Tyvek full body suits can be worn. However, to be impervious to the maximum of the design, all seams should be sealed on these suits. Eye and face protection. Eye protection should also be worn for those involved in the direct contact of known or suspected COVID-19 infectious subjects. Eye protection should provide side protection at the least. Face shields make excellent protection, especially when used in conjunction with eye protection. Know the difference in masks versus respirators and apply appropriately. Guidance for employees. Know the plan. Your employer should have a plan to protect you from the spread of COVID-19, and as an employee, you should ask and understand this plan. This plan will encompass the following concepts to protect workers from COVID-19. Modifying the workplace, including shields, barriers, moving workstations, etc. Social distancing, cleanliness, personal protective equipment, and face coverings. Social distancing. Social distancing, also called physical distancing, means keeping space between yourself and other people outside of your home, and is the most effective means of protection from exposure and spread. Stay at least 6 feet from other people. Do not gather in groups. Any face-to-face contact less than 6 feet is not effective and should only be done in conjunction with wearing a mask. Stay home, stay safe. Employees shall not report to or be allowed to remain at a work or job site if sick or symptomatic with fever, cough, and/or shortness of breath. Non-symptomatic COVID-19 positive workers are not allowed on site. Any workers who have contact with a worker or any other person who is diagnosed with COVID-19 are required to quarantine for 14 days. Hand washing and hand sanitizing. Hand washing is one of the best ways to protect yourself and your family from getting sick. For all workers, regardless of specific exposure risks, practice good and frequent hand hygiene. Follow good cough and sneeze etiquette. Avoid touching the eyes, nose, or mouth with unwashed hands. Avoid close contact with people who are sick, and use hand sanitizer when you can't use soap and water. Follow these 5 steps every time you wash your hands or sanitize them. Wet your hands with clean, running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with soap. Lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. Need a timer? Hum the happy birthday song from the beginning to end twice. Rinse your hands well under clean running water. Dry your hands using a clean towel or air dry them. Masks and face coverings. Masks are an important tool in protection from the spread of COVID-19. In addition to the governor's executive order, the CDC recommends wearing cloth face coverings in public settings where social distancing measures are difficult to maintain. Employees must wear face coverings over their nose and mouth when in the presence of others. In the case of retail cashiers, a translucent shield or sneeze guard is acceptable in lieu of a mask. Medical and surgical masks should be reserved for healthcare workers. To learn how to make your own mask or cloth covering, click on the link. Respirator. Respirators are tight-fitting and considered personal protective equipment. If N95 masks are used voluntarily, there is no need to have fit tests conducted. If respirators are required in a workplace, a fit test must be complete, and the employer needs a full and detailed protection program. Respirators must be used if involved in medical procedures when exposed to aerosolized virus. Links to helpful documents. There are several links to helpful documents located here, including OSHA guidance for grocery and retail worker safety, OSHA guidance for construction worker safety, OSHA guidance for package delivery worker safety, OSHA guidance for manufacturing worker safety, and Agency of Commerce guidance for Stage 1 going back to work. For continual updates, please visit the following web pages. Certificate of completion. By completing the certificate, you certify that you have completed this training and understand the safety guidance provided. Please complete the fillable certificate and provide a copy to your employer. Keep a copy for your record as well. To download your certificate of completion for this training, please visit the following website.